Good afternoon, and welcome to The Quarter. I'm your host, Michael Safey, here with my co-host,
Isabel Schoeneman.
Here on The Quarter, we give you overviews of topics in just 15 minutes.
Our show for you today will take you through two of the most prominent pandemics in U.S. history, the Spanish flu and this year's COVID-19.
Currently, many nations, including the United States, are entering a second wave of cases. Many countries have already locked down, but amid the recent elections, the U.S. has different priorities.
The U.S. has many projections for the future, predicting that we'll reach 313,000 cases by the new year.
Going back to 1918, the Spanish flu caused widespread panic and caused over 675,000 deaths in the U.S. Now, let's take a look at the aspects of the Spanish flu and COVID-19 in the U.S.
Different places have been pinpointed for the starting point, and there's no kind of, everyone says it started here. It's much more kind of, well, there's some evidence it may have started here. There's some evidence that it may have started in Kansas or in China or in Europe. Where it didn't start was in Spain.
According to the CDC, roughly 500 million people, which was 1/3 of the world's population in the early 20th century, became infected with the Spanish flu. The number of deaths was estimated to be more than 50 million worldwide, with about 675,000 occurring in the United States.
That's an enormous impact. Clearly, that was the biggest plague since the Black Death, which killed almost 30%, in some places much higher.
The true source of the disease is still unclear. Some claim it to be an interaction between the chemical weapons and the conditions of the trenches in World War I. Regardless of its true origin, the disease spread slowly in its first wave through the central United States, faded away, then resurged across the globe with devastating symptoms.
And so because of the censorship that was in place around World War I and continued a little bit afterwards, countries were not spreading bad news. They were not spreading the initial sicknesses and the initial illnesses. And hey, all these soldiers got sick. Spain didn't have those restrictions and didn't have that censorship. So in fact, their freedom of press and discussion led to this labeling of the Spanish flu.
Amidst the chaos, some governments heeded no warnings of the dangers of the influenza, and Philadelphia even held a parade. This contributed to more than 4,500 fatalities in the same week. Other states snapped to the conclusion that personal safety led to worldwide safety, and made orders to begin social distancing. With infection rates of Philadelphia, which held the parade, and St. Louis, which practiced social distancing, shown side by side, it's clear that staying away from others leads to a faster flattening of the curve and a healthy future sooner.
I think the fact that the scientific community across the world has come together so thoroughly on this, so clearly, so effectively, speaks volumes to the way the people of the world want to be in cooperation.
In light of COVID-19, a similar mentality can be applied. By working together globally to find a cure for the disease, humanity can stay away from one another to slow the spread. Even as infections continue, social distancing is a safe and easy solution that has saved lives in the past and still holds its effectiveness today.
And I think this might be as grim, as awful, as tragic, and as sad as it currently is, an impetus for change for the better as a world community.
That was Shay Kuhner reporting. About 500 million people worldwide were believed to have the Spanish flu.
Taking a deeper look at the Spanish flu in New York City, Nate Topham explains the historical impact the pandemic had on civilization and how cultural norms of the time influenced the spread.
To begin, let's talk about the last pandemic that occurred in New York City, the influenza pandemic of 1918 to 1919, sometimes referred to as the Spanish flu. New York City at the time had a fairly robust healthcare system for its day, partially because of previous efforts to slow the spread of tuberculosis. The first cases of flu arrived in August of 1918 when a Norwegian ship, the Bergensfjord, brought over ill passengers. Though the pier was placed under quarantine and sick taken to hospitals, it wasn't long before the disease spread to the tightly packed apartments and tenements of the city, with the first death being recorded a month later. The person in charge of leading the city through the epidemic would be recently appointed Health Commissioner Royal S. Copeland. At first, campaigns were started to curb unseemly habits like spitting and unprotected sneezing, all done in an era before radio, TV, and the internet. Though the epidemic progressed, businesses remained open, with there only being a slight change in operating hours to alleviate crowded transit systems. Additionally, schools remained open unlike elsewhere in the country. Theaters, too, remained open in order to spread information about the disease to the public. While these measures may seem relaxed, in the end, New York City had a lower death rate than other East Coast cities like Boston and Philadelphia. The response to this modern coronavirus pandemic today is very different than it would have been 100 years ago. Non-essential businesses are closed, as well as schools, in order to keep people away from each other. People are also encouraged to stay at home as much as possible, and if you must go out, face masks are a must, as well as keeping a few feet of distance between you and others. In comparison, the measures put in place 100 years ago to combat influenza seem quite relaxed. Businesses were allowed to remain open, and schools continued to operate. Today, to fight the ongoing COVID-19 pandemic, non-essential businesses are closed, schools and universities are shut down, and New Yorkers are to wear masks when outside. These measures can seem scary. However, they are in place because we have learned so much in the past 100 years about how diseases spread. We know that social distancing slows transmission exponentially, and we know about washing our hands and covering our coughs and sneezes. We can learn a lot from the past, look forward towards the future, and get excited for the days to come when we can go to restaurants together.
That was Nate Topham reporting. The Spanish flu heavily impacted New York, much like how New York is a hotspot for COVID-19 now. In the last day, New York nearly doubled in positive COVID cases.
Now, here we have a real-time projection of coronavirus cases, deaths, and recovered cases worldwide. As you can see, there have been 1.2 million deaths worldwide due to COVID-19, compared to the appalling 50 million deaths worldwide due to the Spanish flu pandemic.
The UVM Medical Center has been around since the 1800s and has been through both the Spanish flu pandemic and the current COVID-19 pandemic. Ian Noyes has the story on how they are dealing with COVID-19.
The Medical Center has been around for many years. First opening its doors in 1876, the COVID-19 pandemic is not the first of its kind to walk through these doors. Back in 1918, the Spanish flu tore through Vermont, with more than 1,700 Vermonters losing their lives to the Spanish flu. Compared to the only 58 COVID-19 deaths that Vermont has seen this time around, having over 2,000 cases statewide, we have our medical professionals to thank. With Halloween right around the corner, the temperatures are dropping and the risk of coronavirus is at an all-time high. Dr. Benjamin with the UVM Medical Center has tips on staying safe.
There are certain activities that carry a higher risk for infection with COVID-19. And the themes are universal. The activities that are higher risk are large gatherings, particularly indoor gatherings, and activities that involve a lot of close or face-to-face contact. So whether it's in the context of Halloween or any other extracurricular or recreational activity, any activity that brings people in close contact, particularly indoors, is going to be higher risk, whether you're in Vermont or anywhere else.
Doctors recommend to avoid large gatherings and always recommend to wear your mask. The vaccine is next to come for the UVM Medical Center, with a trial starting soon with the AZD1222 COVID-19 vaccine. The UVM Medical Center is looking for volunteers to participate in the trial who are above the age of 18, have not contracted COVID-19 previously, and are at a high risk of contracting the virus. The trial wants at least 25% of its participants to be over the age of 65. The UVM Medical Center has a long history, first opening its doors back in 1876 as the Mary Fletcher Hospital, now serves patients all across the state. For Champlain College, I'm Ian Noyes.
Currently, the UVM Medical Center is dealing with a cyber malware hack from Russian-speaking hackers, making it quite difficult to deal with COVID-19 this winter.
We're going to take a quick break, but when we come back, we'll take a look at what COVID-19 looks like today compared to the past Spanish flu pandemic and how journalism has changed in these trying times.
My favorite thing about volunteering and working with the Red Cross is being client-facing and getting to actually get out and meet people in the community. So as we go around installing smoke alarms, we're getting to hear from different families, hear about their stories, and help make their homes safer.
It's great to interact with these folks and make them more aware so they're thinking about it, and they can, most people are really grateful, especially people with kids and families, they are so busy with other things that having us come in and provide the smoke alarms and help them out makes a big difference.
I recommend if you'd like to volunteer for the American Red Cross, go to redcross.org. We have a page there on volunteering. You can check out what volunteer opportunities we have in the Vermont and New Hampshire area, as well as beyond, and see what best suits your needs and what you're interested in, and go from there and apply as a volunteer.
In the center of Burlington, Juice & More stands out for its healthy, freshly pressed juices on St. Paul Street. Juice & More focuses on sourcing ingredients from Vermont for a local, homegrown feel.
We use a lot of raw, organic fruits and vegetables. We try to source as many things as possible locally.
Juice & More welcomes each and every customer in to make them feel like part of the Juice family.
Welcome back, everyone. We're going to switch gears a little bit and start talking a little bit about how COVID-19 looks today and how it's acting. Logan Chalmers has the overview of the virus and how it has changed how we live.
Thanks, Mike. Fall has arrived here in the United States, and with it, another round of COVID-19. States and schools alike are preparing for a second wave of COVID cases as the cold and flu season approaches. But Dr. Carlos Del Rio claims some states are still neglecting COVID guidelines as cases are on the rise.
We have grossly mishandled the pandemic, and the fact that it's taken off again just reminds us how we're not learning from our mistakes. And we could have avoided this by doing the right thing, but we don't seem to learn.
COVID continues to plague America as cases are already on the rise in states across the country, with some states seeing over a 50% increase. In Vermont, cases have risen by over 50%, and here in Burlington, both UVM and Champlain are preparing to go remote starting the week of Thanksgiving in preparation for a second wave. As Thanksgiving and the holidays approach, traveling will also be a concern, as many are concerned about what the second wave will do to the country.
With the U.S. just now entering the second wave, there are concerns of a second lockdown.
As you can see here, there's already a growing number of red states and counties in the U.S., meaning that the second wave could be much worse than the first, especially because it coincides with the holidays and the yearly flu season. Since the start of COVID-19 pandemic, communication has been hard to follow. Unfortunately, Americans have had a difficult time searching for truth during this time. Lindsay Mulligan shares how the field of journalism has been forced to adapt.
As you can see, where parallels are seen from our media today. There were a total of 675,000 casualties in 1918, but by the end of the pandemic in the U.S. Let's hear from CBS News correspondent
The
Martha
first
Teichner.
serious outbreak in the United States began at Camp Funston, now Fort Riley in Kansas, as infected soldiers from across the country made their way to the trenches in France. The virus spread. But the nation wasn't told. A year earlier, President Woodrow Wilson had rammed through Congress the Sedition Act, making it a crime to say or publish anything negative that would affect the war effort.
Though the COVID-19 pandemic has been difficult for Americans in many ways, finding the truth doesn't have to be hard. When learning about the pandemic, make sure to fact check and get your information from multiple sources. Back to you.
Here at Champlain College, we've had 13,975 COVID tests conducted so far, and of all those tests, only 5 of them have been positive. Unfortunately, that's all the time we've got for today. This has been The Corridor.
And don't forget, in 2 weeks we'll be airing our special public affairs program. And remember everyone, stay safe. Goodbye.